Diet matters to patients. Diet changes our well-being. Diet can cause symptoms. Diet can influence inflammation in the bowel and other aspects of inflammatory bowel disease. And because of this, I think it is very important that our doctors actually pay attention to diet of their patients because of all these reasons. First of all, they should be very interested in talking to patients about a healthy diet, and the evidence at the moment would suggest that the Mediterranean diet is very good. How that translates to a Korean diet is something which I am not sure about, but needs to be looked at. The second thing is that if patients are overweight, too much adipose tissue, or if they are underweight with very small muscles, so what we call myopenia, then these things are associated with poorer outcomes for our patients. And we have evidence from around surgery that if you correct these things with dietary means, then this improves their outcomes. The third area is in inflammation in the bowel, that now there is a worldwide effort to try to find dietary therapies which will act to reduce inflammation in the bowel. And in fact, there now we know that exclusive enteral nutrition and a diet of the Crohn's disease exclusion diet together with that can reduce inflammation, can cause healing, and is very effective therapy. But it's only a very short-term therapy. What we really need is to know what therapies can stop inflammation coming back. Maintenance therapies and diet, and that's a much more difficult area where we don't have the answers at the moment. It's very easy for me to say that doctors all should be implementing diet therapies for their patients in these ways, but there are a few things which make it very difficult. First of all, we as doctors have not been trained as dietitians, as nutritionists in diet, in how to assess diet and how to deliver diets. So that is quite difficult unless we upskill to do this. Secondly, that we have to, because of this, we have to utilise our dietitians, and dietitians need to be also upskilled to work in this area. And in my own country, in Australia, we now have a lot of dietitians who are very passionate and very good at inflammatory bowel disease, but in many other parts of the world this has not occurred and will occur with time. The other problem, of course, is then getting your patients to actually take any notice of what you are telling them. And there was a recent survey in Asia Pacific which showed that most patients take more notice of their other patients, of their family and friends, of the internet than doctors' advice on diet. So we need to be able to deliver it better, and that's where dietitians are a very, very good resource. The other problem is that people like to eat, and so the diets cannot be terrible. They cannot take away the enjoyment of eating because eating is a very social event. So these are the challenges we have that in delivering diet therapies to our patients. But of course, this is what dietitians, this is their what we will call bread and butter. This is their routine work, is to convince patients to actually make changes to their dietary intake. So I have a great hope that in the future, diet will be play a much bigger role in managing our patients with inflammatory bowel disease than it is at present. It won't be the primary therapy very often, but it will be very important to make all of our other therapies that we have work better.